Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What is amenorrhea? What causes it? Break. What is amenorrhea? Break. Amenorrhea is when you don't get your period despite being old enough to have a menstrual cycle. It's normal during certain stages of life, such as pregnancy or menopause. Break. Unlike irregular periods, amenorrhea means your period stops completely. While it's not a disease, the absence of a regular period could be a sign of a medical condition that needs treatment. So, it's important to talk to your doctor if you have it. Break. Amenorrhea types. Break. There are two types of amenorrhea. Break. Primary amenorrhea. This is when people assigned female at birth don't get their first period by the age of 15. Break. Secondary amenorrhea. This is when you've had periods in the past, but they stop for 3 or more months in a row. Break. Causes of primary amenorrhea. Break. There are many reasons why you might not get your first period by the time you turn 15. Most of the time, it has to do with hormone levels or a problem with the reproductive system. Break. Here are some possible causes of primary amenorrhea. Break. Ovarian problems. Ovaries that don't work properly can delay your first menstrual cycle. Break. Brain or spinal cord issues. Problems with the central nervous system can affect the hormone signals needed for a period. Break. Pituitary gland problems. The pituitary gland is a part of your brain that controls hormones involved in menstruation. Break. Structural differences. Sometimes the uterus, vagina, or other female sex organs form in a way that prevents menstruation. Break. Certain genetic conditions can also cause amenorrhea. This includes break. Turner syndrome. When you're born with a missing or damaged X chromosome, your ovaries may not develop properly or make enough estrogen. Break. Androgen insensitivity. This happens when the body doesn't respond to hormones needed for growth and development. Break. Sometimes, there is no clear reason why someone's first period is late. It's still important to talk to your doctor to figure out what's going on and find out what to do next. Break. Causes of secondary amenorrhea. Break. Common causes of secondary amenorrhea, when you've had normal periods but stop getting them, include break. Pregnancy, breastfeeding, perimenopause and menopause-long-lasting birth control, such as th_speak greater than E-shot, implant, or intrauterine devices, IUDs. Break. Other causes of secondary amenorrhea include break. StressPoor, nutritionLow, body weight, 10% below normal weight, DepressionCertain, prescription drugs, including antidepressants, antipsychotics, blood pressure medicines, and allergy medications, extreme weight loss, overexercising, ongoing illness, sudden weight gain or having obesity, polycystic ovarian syndrome, PCOS, thyroid gland disorders, tumors on the ovaries or brain, rare chemo and radiation treatments for cancer, uterine scarring. Break. If you've had your uterus or ovaries removed, you will stop having a period. Break. Post-pill amenorrhea. Break. You may not get a period if you take birth control pills continuously. This means you take and number 156, active, and number 157, pills, with hormones in them, each week. Your menstrual cycle usually returns to normal when you stop taking the pill. But it may not get back on track right away. Break. If you stop taking birth control pills and don't get your period for several months, you may have post-pill amenorrhea. This happens because the hormones in birth control interrupt your regular menstrual cycle. It can take time for your body to adjust. Break. What other symptoms might come with amenorrhea? Break. The biggest sign is missing your period. Other things can happen with amenorrhea, but it depends on the cause. You may also have these symptoms. Break. Extra body hair, hirsutism, acne, hair thinning or loss, headaches, low breast growth, milky discharge from your breasts, vision changes, not ovulating, hypothalamic amenorrhea. Break. Hypothalamic amenorrhea, or functional hypothalamic amenorrhea, FHA, happens when your period stops because of problems with your hypothalamus. That's a part of your brain that helps control your hormones, including the ones that manage your menstrual cycles. Break about 1.62 million women and people assigned female at birth get hypothalamic amenorrhea. It causes 20% to 35% of cases where periods stop in people aged 18 to 44. Break what causes hypothalamic amenorrhea? Break there are a few common reasons your hypothalamus might stop working as it should. Break exercising a lot. Intense or frequent workouts can throw off your hormones. Break stress. Mental stress can affect brain signals that trigger hormones. Break not eating enough. Your body needs fuel to support a possible pregnancy. Break disordered eating. Conditions such as anorexia or binge eating can affect your period. Break hypothalamic-lasting. Speak I see amenorrhea symptoms. Break other than a missed period, you might not notice signs of hypothalamic amenorrhea right away. But it can lower estrogen, which can lead to issues such as break feeling depressed or anxious, high cholesterol or blood pressure, bone thinning, trouble getting pregnant, infertility. Break if hypothalamic amenorrhea and low estrogen go untreated for months or years, you're more likely to have heart and blood vessel problems, cardiovascular disease, and serious bone loss, osteoporosis. Break how do you diagnose hypothalamic amenorrhea? Break to figure out if you have hypothalamic amenorrhea, your doctor will ask about your medical history, lifestyle habits, and symptoms. They'll also rule out other possible medical causes of missed periods, such as break pregnancy thyroid issues, hyperprolactin levels, hyperprolactinemia, premature ovarian insufficiency, polycystic ovarian syndrome, PCOS, pituitary gland problems. Break your doctor might break take some blood to check hormone levels, do imaging tests to check for problems with ovaries or other reproductive organs, ask questions about your stress levels, eating patterns, and exercise habits. Break by taking your whole mental and physical health into account, they can figure out what treatment and support you might need to get your period back. Break hypothyroidism and amenorrhea. Break hypothyroidism is when your thyroid gland doesn't make enough thyroid hormone. This tiny gland in your neck plays a big role in controlling hormones that affect many body processes, such as your metabolism, heart rate, and menstrual cycle. Break when your thyroid hormone levels are low, your body may make more prolactin and number 148, the hormone that helps with making breast milk, lactation. High levels can interfere with ovulation and number 148, the process where your ovaries release an egg. Break if you don't ovulate regularly, your periods might stop or become irregular. Break what about hypothyroidism and amenorrhea? Break on the flip side, hypothyroidism and number 148, when your thyroid makes too much hormone and number 148, can also cause period problems. It might make your cycles lighter, less regular, or absent. Break amenorrhea diagnosis. Break since many things can cause amenorrhea, it may take time to find the exact reason behind your missed periods. Break your doctor will ask about your medical history and do a physical and pelvic exam. If you're sexually active, they'll likely begin with a pregnancy-speak test to rule that out. Break they may ask you questions such as, break how old were you when you had your first period? Do any of your family members have a history of missed periods? What is the typical length of your menstrual cycle? Have you gained or lost weight recently? Do you exercise a lot? Are you an athlete? Are you under a lot of stress? What are your eating habits like? Break it may take several kinds of tests to find the cause of amenorrhea, such as break blood tests. These measure the level of hormones such as follicle-stimulating hormone, FSH, thyroid-stimulating hormone, prolactin, and androgens. Too much or too little of these sex hormones can interfere with the menstrual cycle. Break imaging tests. Ultrasound, Connecticut, and MRI can look for problems with your reproductive organs or detect tumors. Break hormone challenge test. Your doctor will give you hormonal medication. If you don't have vaginal bleeding after stopping it, low estrogen could be the cause of amenorrhea. Break hysteroscopy. Your doctor will put a small lighted camera through your vagina and cervix to look for anything unusual inside your uterus. Break genetic screening. These tests check for genetic issues, such as changes to the FMR1 gene, that can stop the ovaries from working properly. Break chromosome tests, karyotype. These look for missing, extra, or rearranged cells in certain chromosomes that could explain your symptoms, Turner syndrome, for example. Break amenorrhea risk factors. Break certain things can raise your chances of missing periods, whether it's primary or secondary amenorrhea. Break you're more likely to have amenorrhea if you have. Break family history of early menopause or missed periods, past medical procedures that affect your uterus, structural differences in your uterus, cervix, ovaries, or vagina, change in the FMRI gene, Fragile X syndrome. Break other factors that raise your risk of amenorrhea include: break intense physical activity, especially if you're training for sports, problems maintaining a healthy weight, underweight or obesity, trouble with stress management, history of disordered eating, anorexia nervosa or binge eating disorder. Break other common amenorrhea risk factors include: break pregnancy or breastfeeding, perimenopause or menopause, ongoing use of hormonal birth control, such as shots, implants, or intrauterine devices, IUDs, antipsychotics or antidepressants, cancer treatment, chemotherapy or radiation, some other speak prescription drugs, such as meds for blood pressure or allergies. Break if you're worried you might be at risk for amenorrhea, check in with your doctor. They can assess your risk and guide you on what to do. Break amenorrhea treatment. Break treatment for amenorrhea will focus on the condition that causes it. Hormone replacement therapy or birth control pills can help start your menstrual cycle again. A thyroid or pituitary disorder can be treated with medication. Physical abnormalities may need surgery. Break if things such as stress, weight gain or loss, or depression are affecting your menstrual cycle. You can take an active role in your treatment by taking steps to manage it. Friends, family, or your doctor may be able to help you. Break you can help your doctor trace the cause of your amenorrhea by tracking changes in your cycle and symptoms and sharing this information with them. Tell them about your medications as well as changes in your diet, exercise habits, and stress levels. Break amenorrhea complications. Break you may not have any problems from a few missed periods. But untreated amenorrhea can sometimes lead to more serious health issues. Break here's what can happen. Break fertility problems. If you don't ovulate, release eggs, it's harder to get pregnant. Break bone loss. Missed periods can lower estrogen, which weakens bones. Break heart issues. Your cholesterol, blood pressure, and blood sugar may go up if you have amenorrhea due to low estrogen. This makes heart disease more likely. Break mental health issues. Stress about missing periods is common. Hormonal imbalances can also cause mood and thinking problems, like depression and anxiety. Break pelvic pain. Some causes of amenorrhea, like anatomical issues, can cause pain. Break endometrial hyperplasia and cancer. Without regular periods, the uterine lining can become too thick due to excess estrogen. This condition, called endometrial hyperplasia, can sometimes lead to uterine cancer. Break takeaways. Break amenorrhea is when you don't have a period, even though you're old enough to have one. Natural causes include pregnancy, breastfeeding, and menopause. Break if you haven't had a period in at least 3 months and don't know why, see your regular doctor or OB/GYN. It could be a sign of a hidden health issue that needs treatment. Your doctor can help you figure out what's going on and what to do next. Break amenorrhea FAQs. Break how do I get my period back /speak. Speak break treatment depends on what's causing amenorrhea. If you have ovarian problems, hormone therapy can help get things back on track. Stress management, good nutrition, and maintaining a healthy weight may work in other cases. The best way to get your period back is to talk to your doctor. Break how much delay in periods is normal. Break most periods get off schedule every now and then. But you should talk to your doctor if you haven't had a period for 3 months or more and you don't know why. Or if you've reached age 15 and are yet to get your first period, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.